start with the complaint handling. This is again an important BDA sheet. There are few questions that do come on exam, and I have marked everything on this BDA sheet. So let's start it together. So in the overview, that's not that really important. It was just like I marked when I was reading. It's like that you don't need to remember something really for the exam from this all. So let's just start. It says the Consumer Right Act 2015 made it easier for patients to understand their rights as consumers of goods and services and to know what they can reasonably expect from any service they receive. It allows them to claim a refund, repair, or any replacement if the quality of their treatment is not satisfactory or the treatment is not fit for the purpose I described. So, resolving the patient complaint without a delay vital for a good patient relationship. A lead person to manage complaint will help you to ensure that the patient have the information that they need to provide feedback or complain. Not that important, just give a read to the key learning points, nothing really important. And the handling complaint positively, most patient complaint result from expectations about the services, not the technical skills. So most patients usually complain that's related to the services, not to the technical skills or the clinician and or the quality of the care. Poor communication, rudeness, and the treatment cost are typical non-clinical causes of the complaint that you could keep to a minimum by ensuring good practice system and a positive and professional attitude and keeping the patient informed. Now, complaints about the treatment can be more difficult to prevent, but the effective system attitude and the patient involvement can aid resolution. Again, it's just you need to read this. The cost of the treatment is major concern for the patient, and many complaints are caused by the lack of the clarity. Now, that's the major concern of the patient. They do ask sometimes, what is the major concern of the patient? Is the quality of the care, or rudeness, technical skills, or cost? So, cost is one of the major concern. And treatment plans and cost estimate will help ensure that you provide sufficient information to allow the patient to make choices with your confidence, but you need to keep them updated if there are changes to the proposed treatment. An indicative price list must be displayed prominently in the practice can be useful addition. Okay, now complaints are usually made by the patient or a legal guardian or representative directly to the practice, or less commonly an NHS treatment only to the appropriate NHS body, and resolving a complaint at a practice level is everyone interest. Now, the NHS provides some useful time limits for the patient to complain. Now, that's the useful time limit that's important within 12 months of the cause or when it was first noticed. It's in England and Wales. So, NHS provides some useful time limits for the patient to complain. If something goes wrong with the patient uh, in the clinic, so that patient has a time limit to lodge a complaint against a dentist. So within 12 months of the cause or when it was first noticed in England and Wales, and within 6 months of the cause when the cause was first noticed, but within 12 months of the date of the cause, Northern Ireland and the Scotland. It's not that really important that you need to remember everything for Northern Ireland and the Scotland. All we need to remember for the England and Wales specifically. So within 12 months of the cause when it was first noticed, right? So learning from complaint, you will always learn something from your complaint to do better, to raise a concern, and from the patient that then to discover they have reported. Okay, now discuss their concern and identify real issue, offer an apology, explain what you will do, and tell the patient when they can expect to hear from you about the matter. Okay, keep a log of a complaint and the comments, good or not so good, that you receive about the practice to help you identify the trends and recurring issues. Now, about training, all team members should be understand the practice procedure for handling complaint and receive training in customer care and communication skills, particularly in relation to angry, aggressive, upset patient. So this is just a read to this paragraph. Now, resolving complaint, no matter how careful and you still face the possibility of receiving a complaint from a patient. You need to consider who will be the responsible for dealing with complaints, how you manage complaint, information for patient, information for team. Now, responding to the complaint is the NHS requires that you appoint a responsible person to ensure compliance with the complaint procedure, and and a complaint manager who deals with all complaint. The responsible person and the complaint manager can be the same person. Now, the NHS contracts for England and Scotland stipulate that the responsible person must be contract holder in England. The contract holder will be an individual, a partnership, or a director of a company. Okay, so that's the difference now. In Scotland, the responsibility can be delegated by a contractor to another suitable person within a practice. But in England, that person need to be a partner or a director of a company, or either he's the person like who holds the contract. Now, in private practice owners or the practice manager should manage any complaint received and ensure that agreed procedure is followed. Okay, so the complaint made in person, identify plan where you will receive complaint made in person. For that, you need to identify area where a complaining patient can explain their concern in a private, for example, the practice manager office, a general office, a staff room, or a vacant surgery, so that it should not disturb the another surgeries or any other patients, because that should not be loud in the clinic. So these are few things that you need to remember that should need to be made in person. So information for patient, you must have information for patient that is readily available. How to make a complaint, you must make it easy for patients to raise concern, complain, or provide feedback. Your patient information should follow GDC guidance and explain that all feedback is important, and you want to know that what went well and what could be done better to help improve and learn. This is the few points that you just need to read only. So just give a read to this for like 1, 2, 3, 4, 5, 6 points. Okay. And the information for your team, you must be confident your team understand that how you will receive and deal complaints and feedback. Receiving complaints, how you will going to acknowledge it, how you will investigate, and how you will keep records. The procedure should be followed routinely for all complaint, unless, for example, the complaint is raised verbally and resolved quickly. So you need to uh, the procedure should be followed routinely for all complaints, unless, for example, the complaint is raised verbally and resolved quickly within 24 hours. However, you must keep the record of all complaints even if a formal procedure is not followed. So you need to keep a record. Now, the practice procedure. Practice procedure, it's not that important. If you want to give a just read, so read it. Nothing really important. Whatever I've marked, it's just if you want to read it, so read it. Acknowledge, if you are working under NHS contract, you must comply with NHS time scale for acknowledging a complaint within 3 working days. That's really important. So if you're working under an NHS contract, so you must acknowledge the complaint within 3 working days in England, Northern Ireland, and Scotland, and within 2 working days in Wales. These timescales provide a useful guide for private dentistry. Your acknowledgement must offer the patient the opportunity to discuss the cause of the complaint. Okay, in England, Citizen Advice Bureau or local patient group and contact details, health services ombudsman, and these are the bodies that is linked who are going to deal with the complaint. In England, that's the ombudsman, and in Northern Ireland, that's the patient and client council. In Wales, that's all different. So written response will ensure that the relevant information is given to the patient and provides you with the useful record. You must let the patient know that who will be dealing with their complaint and keep them informed of your progress, including delays, by their preferred method, by telephone, face to face meeting, email, or letter. Or example, this line is important, the method: telephone, face to face meeting, email, or letter. Now, investigate. You need to understand what the complaint is about, the patient view of the events, and any concern they might have. Although the patient may reasonably want to recoup the cost of the failed treatment or a rectification, their motivation for complaining may because they want an explanation rather than financial gain. Now, investigate the substance of the complaint. If the investigation requires the patient records to be disclosed in person, Other than a member of a practice team or legal representative, the patient must be informed and give the written consent. This is really, really important here. So, who can take the records and where the patient records to be disclosed, and the written consent is really important. So read this three lines thoroughly. For a complaint relating to the provision of treatment under NHS, you should provide the patient with the response within a required time scales. So I would say that in this whole BDA sheet, wherever you see the word time scale, just remember the time scales are really important in this BDA sheet. So in England, so you should provide the patient with the response within required time scale. In England, promptly within 10 working days. And there is an outer limit of 6 months if the delay can be justified. Northern Ireland within 10 working days. Scotland within 20 working days. Wales is within 30 working days of the receiving of the complaints. Right? Investigation should be concluded within 6 months or in a 1 year if liability issues are identified. If the investigation is taking longer, you should inform to the patient, offer an explanation, keep them informed. In Scotland, you should also let the patient know that they can take their complaint to the Scottish Public Services Ombudsman if they do not agree with your reason for a delay. Now, respond and appeal. Respond and appeal. Okay. Respond when you have completed your investigation. You should provide the patient with a full written response signed by the complaint manager and the responsible person who explains. Okay, now model response letters are available in expert if you are offering redo work. Okay, if you are offering redo work free of charge or at a reduced cost, or give a full or partial refund fees, you should make it clear that this is a gesture of goodwill and does not imply an admission of liability. The response should be sent to the patient by first class post and marked private and confidential. The complaints manager should telephone the patient to ensure that they have received the letter. If you find that the practice and your staff are not at fault and there was no basis for the complaint, your written response should explain what happened, why it happened, acknowledge, emphasize, avoid saying or implying that the practice is right, that the patient made a mistake, or that the patient cannot be expected to understand clinical dentistry or how the NHS works. Just give a good read here, and this point is really important. So just keep in mind, sometimes they do give this question. Now, the appeals, where you will going to appeal the same bodies, whatever I just explained in the above slides. So, public health services ombudsman. The ombudsman will undertake an independent investigation to assess whether you acted properly or fairly to provide a proper service. So for England, we said that the Parliamentary and Health Services Ombudsman is the body which deals uh, the complaint. Now, this is the independent body and that investigate to assess that whether the you have acted properly, fairly, and provided a proper service. It is the final point or the contact for complaints. However, if the patient has taken or intend to take a legal action, the ombudsman may not be able to consider the complaint. The view of the ombudsman is final one, but if the correct procedures have not been followed, the patient could seek judicial review in the courts. The ombudsman will consider your procedure and describe your complaint. The six key principles are really important, so just remember by heart: getting it right, being customer focused, being open and accountable, acting fairly and proportionately, putting things right, seek continuous improvement. That's important. Now, the ombudsman may regard as maladministration. Just read this. This is really important again. You must cooperate with the ombudsman investigation and provide information, answer question, attend meetings and request it. If the ombudsman decides that the complaint is justified, and it can recommend that you provide a remedy or put the patient in a position that they would have been if they had been treated fairly in the first place. This may require you to provide an apology, improve your procedure to prevent the others suffering in a same way, if not then involve payment, if not involve payment. Okay, all right. Now the dental complaint services. So remember one thing. So if the patient are coming from NHS, if there is an NHS patient, so they will lodge their complaint in Public Health Services Ombudsman. The patients from the NHS. And if the patient are from the private practices, so they will lodge the complaint in the dental complaint services. Was established by GDC to resolve the complaints about the GDC to resolve the complaints about private dental care. So DCS deals with the private dental care and the ombudsman deal with the NHS. So it will help patients seek an explanation, an apology, a full or partial refund of fees, remedial treatment by the original dentist, or a contribution towards remedial treatment by another dentist. It cannot help with complaints that are more than 12 months. So again, there's a time scale that if the complaint has gone more than 12 months, all professional behavior issues and compensation claims. So it cannot help with the complaints. If the complaint is not being lodged within 12 months and it has gone over the period of a time of 12 months, so DCS will not be able to deal with such complaints. Just give a read here to this paragraph. And records, you must keep full records of the complaint investigation responses. The complaint record should include the original complaint and the date it was received, who received, attach copies of any communication, records of conversation, details of a complaint and result of subsequent investigation, contemporaneous notes of telephone, the outcome of the complaint, action taken by the practice, correspondence between patient and practice. Now, reports to the NHS. If you hold an NHS contract, you will need to prepare regular reports for your primary care organization on a number of complaints received, the issues raised, and the remedial action, the number of referred, and the number referred to the ombudsman, and in Scotland, the number of complaints where alternative dispute resolution service were used. Annually, at the end of each contract year, 1st April to 31st March in England and Wales, and quarterly in Northern Ireland and Scotland. So this is for the reports and records. Alternative dispute resolution. If requested, the NHS board must provide alternative dispute resolution. Not that important. The things which are really important are the time scales, the records, and uh, the difference between the ombudsman, NHS, and if there's a private practice, so the patients will complain in dental complaint services. Other than that, you need to remember the 6 key principles and these working days and the acknowledgement. I guess that's all for this BDA sheet.